Welcome. I'm Dr. Tom Dawson. Today we're going to talk about something that's not the most serious illness in medicine, but something that we're all going to deal with, and that's diaper rashes. And remember, this is just the internet. I'm not really there, so I can't be your real doctor. I'm just here to try to explain these things a little bit and make raising your children a little bit easier. If you ever have any real concerns about what's going on with your child, you need to see your real doctor. So let's talk a little bit about the main kinds of diaper rashes and what to do about them. The first that you're going to come in contact with is from those first couple of months where your baby is pooping. Some children will poop every time you feed them, so they may be pooping 8 times a day. And you're being a good parent and you're going in there and you're cleaning them really well 8 times a day. That's a lot of pooping and cleaning each day. And if you even washed your face with soap and water 8 times a day, that'd be a lot of face washing and enough to probably irritate the skin of your face. So to understand a little bit about how your skin works and how washing works, your skin is essentially covered with a thin layer of oil that sort of serves, I like to think of it as sort of like a little thin plastic barrier that sort of protects your skin from all the evil irritants that are in the outside world. And for practical purposes, the thicker that layer of plastic, or in this case oil, the better it protects your skin. So we'd like to preserve that oil as best we can. The way most washing of our skin works is when we wash our skin, we put soap or things on there that bind with that top layer of oil and sort of strip off the upper layer of oil and any dirt that's on top of it. So if you wash your hands, you have cleaner skin, but there's a little bit less oil, available to your skin. And if you're like me in a doctor's office where you're washing your hands 60 times a day, at the end of the day, your hands are going to be pretty dry. So here we have a little baby pooping maybe 8 times a day, and you're taking wipes like all your friends and cleaning them really well. And that just keeps stripping layers of oil until there's just really not enough oil left to protect their skin there. And the littlest poops that come out in babies is a little more acidic than your average stool. And so it actually causes almost like a mild acid type burn to the skin on their bottom. And if you look at it, it kind of looks like, that it's a mild acid type burn. So what I want us to do to help with this is, first of all, I want us to strip off less of the oil off of their skin. Now, when you're out and about, out in the real world, I want you to go ahead and use wipes like all your friends. I'm not going to turn you into a total nut. But when you're home, if you'll use baby lotion on Kleenex and use that to clean them off when they're dirty, it will clean them just fine. And instead of taking off a layer of oil, it'll actually even leave a little bit of oil behind. So when you're out with your buddies, fine to use wipe. But if you're at home and we can use the baby lotion on Kleenex, that'll usually preserve enough of the oil in the skin to avoid this type of rash, altogether. If doing that's not enough, then you may want to go and you can get some of the over-the-counter products that have zinc oxide and petrolatum in them. There's tons of them available. And you could add that after you've changed your child's diaper. And that'll add a little protective barrier to their skin there. It also kind of helps to let a little air get in there. So you might leave the diaper on a little bit looser so air can circulate better, or even leave them uncovered a little bit. And those things will all help. We used to use powders quite a bit. We don't use those as much anymore, primarily because when you're putting powder on their bottom and it was floating around all the air and they were sucking all that powder into their lungs, probably not the best thing. So I would say try to use as little powder or maybe let's just not use powder at all anymore. So now you know the basics about how the skin works and how diaper rashes work. So we'll tell you a little bit about the other typical diaper rashes that you may come across. And we'll introduce you to a few of what I would call Tom Dawson rules. These are rules that are not perfect. These are rules that maybe cover 90%, but 90% is not that bad when you're just trying to figure out what's going on with your baby. So let's talk about those. So the first rule would be if the rash is in front, up around their genitals and stuff, it's probably a yeast rash. 90% of the time, if the rash is up front and it's not in the back, it's going to be a yeast rash. Especially it'll look a little beefy red with sometimes little red, what they call satellite lesions around the edge. But if it's in front, 90% of the time it's yeast. Go to your local pharmacy, get a little Lotrimin type antifungal ointment, and you can put that on a few times a day and get rid of it in just a few days. So that's the first rule. The second rule is if the rash is in back, 90% of the time it's going to be an irritant rash caused by the skin being in contact, with the stool. And that rash is going to be very similar to the rash we talked about in those babies' first months, where if we can just clean them off with lotion, maybe put a little zinc oxide kind of ointment on there, maybe leave it open to a little bit of air, like we talked about. That will take care of most of those irritant type rashes in the back. Sometimes if the rash is caused by a child having diarrhea, where they're having tons of stools every day, and that's causing a lot more irritation in back, and it gets that really acid burn look, I will sometimes give my children maybe a teaspoon of an old-fashioned antacid like Malox or Mylanta, and that antacid will help make their gut heal faster, both inside and then the stool that comes out, and in the end won't be as acidic, and so won't burn their bottom as bad. That's something that I've done. You might want to talk to your own doctor before doing that with your child. So that's the first and second. The third and much, much less likely option is sometimes when your baby or your younger child gets an unusual rash that you weren't really expecting them to get, a diaper rash, or maybe they've even grown out of that diaper rash age, sometimes they'll get sort of a bright red ring just right around their anus that just seems red and inflamed. And that frequently can be caused by a little strep infection, not too dissimilar from the kind of strep that causes strep throat. If they were to get that sort of bright red rash just right around the anus, that'd be something worth going to your doctor and letting them culture you and probably putting you on antibiotics. So those are the main kinds of diaper rashes. Now you know pretty much what you need to know. To give you an idea of frequency, I would say probably 90% of the rashes I see are going to be just the irritant type, like we talked about, that are in back, usually caused by the skin being in contact with stool, and that work best by cleaning with lotion, maybe a little bit of a zinc oxide and petrolatum kind of ointment, and a little bit extra air. The second most common is going to be the yeast rash, which I'd say that would be maybe 9% of the total diaper rashes that I see. And that's the one that will respond to your getting a Lotrimin type lotion to put on it for a few days. And then the perianal strep rash that we talked about, the little fiery red area just right around their anus, is pretty uncommon, probably less than 1% of the diaper rashes that I see. And that's the one where you'll need to go see your doctor so that he can see it and maybe culture it and start you on antibiotics. So that covers most of the things that you need to know about the diaper rashes. Certainly, I hope that this will help you take care of them. If you have any concerns, always I would want you to take them to your own doctor so that they can have a look. I hope this will help.